Have you ever noticed a loved one suddenly forgetting things they used to remember easily? Maybe they're repeating themselves more often, or they seem confused about things that were once second nature to them. Your first thought might be, well, they're getting older, this is just part of aging. But what if I told you that sometimes it's not age at all? What if it's actually the medications sitting in their medicine cabinet? I know that's an unsettling thought. Every day, millions of seniors take medications that doctors prescribe with the best intentions, medications that are supposed to help them feel better, sleep better, or manage their health conditions. But here's what many families don't realize: some of these common medications have been linked by researchers to an increased risk of cognitive decline and dementia-like symptoms. Now, before you panic, let me be clear. I'm not telling you to throw away your medications. What I am saying is that knowledge is power, and understanding these potential risks can help you have better conversations with your healthcare providers and make more informed decisions about your health. In the next few minutes, we're going to explore 9 types of medications that research has connected to memory problems and cognitive decline in older adults. Some of these might surprise you. They're medications that many people consider completely harmless. By the end of this video, you'll know what warning signs to watch for, what questions to ask your doctor, and how to advocate for yourself or someone you love. Before we dive in, I'd love to know where you're watching from today. Drop a comment and let me know your city or country. It always amazes me how this community spans the globe. All of us united by our commitment to better health and wellness. And if you find this information valuable, consider subscribing to our channel. We share evidence-based health information for seniors every week because staying informed is one of the best ways to stay healthy. Number 1. Sleep medications, benzodiazepines. Let me paint you a picture. Imagine your father has been struggling with insomnia for months. He's tired, frustrated, and his quality of life is suffering. So he goes to his doctor, who prescribes what seems like a simple solution, a sleep medication like Xanax, Valium, or Ativan. These belong to a class of drugs called benzodiazepines. At first, it seems like a miracle. He's sleeping better, feeling more rested. But then, over the following months, you start noticing something concerning. He's forgetting appointments more often. He seems confused about things that used to be routine. His thinking just doesn't seem as sharp as it used to be. Here's what researchers have discovered. Long-term use of benzodiazepines can slow down brain signals and increase confusion. Multiple studies have found a connection between prolonged use of these medications and an increased risk of dementia. The drugs that were supposed to help him rest might actually be interfering with his brain's ability to function clearly. The tricky part is that families often think these are just harmless sleep aids. After all, they're prescribed by doctors, right? But the truth is, these medications were originally designed for short-term use, typically no more than a few weeks. When they're used for months or years, the risks can start to outweigh the benefits. If you or a loved one is taking sleep medications long-term, don't panic, but do have a conversation with your healthcare provider. There are often safer alternatives: improving sleep hygiene, trying relaxation techniques, considering melatonin supplements, or exploring other non-medication approaches to better sleep. If you're still not subscribed, I have to ask, why? Imagine finding out too late that a simple pill destroyed years of your loved one's memory. Don't risk being that family. Subscribe now, or if you won't, tell me in the comments why you'd take that chance with the people you love most. But sleep medications aren't the only everyday pills that can affect memory. Number 2. Antihistamines, diphenhydramine. Picture this scenario. Your grandmother has been dealing with allergies, so she picks up some Benadryl from the pharmacy. It's over the counter, it's been around forever, and it helps with her symptoms. What could be wrong with that? But after a few weeks of regular use, you notice she seems more disoriented than usual. She's having trouble following conversations, or she seems confused about what day it is. You might assume it's just a rough patch, but there could be more to the story. Here's what happens in the brain. Benadryl and similar antihistamines block a chemical called acetylcholine, which is crucial for memory and learning. When you block this chemical regularly, especially in older adults whose brains are already producing less of it, you can see significant impacts on thinking and memory. The challenge is that many families assume that over-the-counter means completely safe. But just because you don't need a prescription doesn't mean a medication can't have serious effects, especially when used regularly by older adults. The good news is that there are often alternatives. Non-sedating antihistamines like Claritin or Zyrtec may be safer options for long-term use. Always check with a pharmacist or doctor about which allergy medications might be best for your specific situation. If you're still watching, type 3 in the comments. And if you haven't subscribed yet, seriously, what's holding you back? Every week, I share life-saving insights like these. If you choose not to join this community, at least explain why in the comments. I want to understand what's preventing you from protecting yourself and your family. And that leads us to another surprising group of medications. Number 3. Certain antidepressants, tricyclics. Depression is a serious health condition, and treating it properly is absolutely important for overall well-being. But some older types of antidepressants, particularly tricyclics like amitriptyline, can have unintended effects on memory and thinking. Imagine a senior who's been struggling with depression. Their doctor prescribes an antidepressant, and while their mood might improve somewhat, family members start noticing that they're having trouble with daily tasks they used to handle easily. They might forget to pay bills, lose track of appointments, or seem generally more confused. The problem is that some of these older antidepressants interfere with the same brain chemicals that are important for memory and clear thinking. Families often assume that any cognitive changes are just the depression getting worse, not realizing that the medication itself might be contributing to the problem. This doesn't mean antidepressants are bad. Depression itself can absolutely affect memory and thinking, and treating it is crucial. But there are newer antidepressants available that may have fewer cognitive side effects. If you notice memory problems starting or worsening after beginning an antidepressant, it's worth discussing with the prescribing doctor. If you're still following along, I'd love to know. Type 3 inches in the comments. It helps me understand how many people are really engaged with this important information. Now let's move to something that might surprise you even more: medications for bladder control. Number 4. Bladder control medications. Bladder control issues are common as we age, and they can be embarrassing and isolating. So when a doctor offers a medication like oxybutynin or tolterodine that can help, it often feels like a relief. But here's a story that might sound familiar. An elderly woman starts taking bladder medication and initially feels good about having more control over her symptoms. But within a few months, her daughter notices she's struggling to recall the names of her grandchildren, or she's getting confused about familiar places. These bladder medications have what doctors call anticholinergic effects. They block the same brain chemical we talked about earlier, acetylcholine. Research has found a direct link between these types of medications and increased dementia risk, especially with long-term use. The heartbreaking part is that families often assume the memory loss is just normal aging, never connecting it to the bladder medication that seemed so helpful at first. If you or a loved one is taking bladder control medication and you're noticing cognitive changes, don't suffer in silence. Talk to your healthcare provider about alternative management strategies. There may be other approaches that can help with bladder symptoms without the cognitive risks. But medications for comfort aren't the only concern. Some painkillers can be problematic too. Number 5. Pain medications, opioids. Pain management in seniors is incredibly important. No one should have to live with constant pain, but stronger pain medications, particularly opioids like morphine, oxycodone, or fentanyl, can have significant effects on the brain. Picture this: after a surgery or injury, a senior starts using prescription pain medication. At first, it provides much-needed relief. But family members start noticing increased confusion, difficulty concentrating, or episodes where their loved one seems out of it even when they're not in obvious pain. Opioids affect brain receptors in ways that can increase the risk of delirium and confusion, especially in older adults. Long-term use has been associated with cognitive decline and increased dementia risk. This is a particularly challenging situation because pain itself can affect thinking and quality of life. The goal isn't to eliminate all pain medication, it's to find the right balance and explore all available options. If you're dealing with chronic pain, ask your healthcare team about non-opioid pain management strategies. These might include physical therapy, nerve blocks, anti-inflammatory medications, or other approaches that can provide relief with fewer cognitive risks. Painkillers aren't the only everyday medications that can be problematic. Let's talk about something many people take regularly: heartburn pills. Number 6. Acid reflux medications, PPIs. Heartburn and acid reflux are incredibly common, especially as we get older. Medications like omeprazole, Prolosec, or esomeprazole, Nexium can provide excellent relief and are widely considered safe for most people. But here's what researchers have discovered: long-term use of these medications, called proton pump inhibitors or PPIs, can interfere with your body's ability to absorb vitamin B12. And your brain needs B12 to maintain sharp memory and clear thinking. Imagine someone who's been taking a PPI for years to manage their reflux. Gradually, they start experiencing what they might describe as brain fog, trouble concentrating, difficulty finding words, or general mental cloudiness. They might never connect this to their heartburn medication. The key word here is long-term. Short-term use of these medications is generally fine and often very helpful. But if you've been taking them for months or years, it might be worth discussing with your doctor whether you still need them or whether there are other ways to manage your reflux symptoms. And speaking of long-term medication use, let's talk about drugs that are sometimes used to manage behavioral symptoms in seniors. Number 7. Antipsychotic medications. Sometimes, seniors with dementia or other conditions may develop behavioral symptoms, aggression, agitation, or severe anxiety. In these challenging situations, doctors sometimes prescribe antipsychotic medications like risperidone or haloperidol to help calm these behaviors. While these medications can sometimes be necessary in severe situations, research has shown they can alter brain chemistry in ways that may actually accelerate cognitive decline. Some studies suggest they can double the risk of dementia progression in certain populations. The story often goes like this: an elderly person with mild cognitive impairment starts having behavioral issues. A medication is prescribed to help manage these behaviors, and while the aggression might decrease, family members notice that their loved one's memory and thinking seem to decline more rapidly than expected. The challenge is that behavioral symptoms can be incredibly difficult for families to manage, and sometimes medication feels like the only option. But research suggests that behavioral therapy, environmental modifications, and other non-drug interventions should be tried first whenever possible. If a loved one is on antipsychotic medication, don't stop it suddenly. That can be dangerous, but do have ongoing conversations with their healthcare team about whether it's still necessary and whether other approaches might be effective. If you're still here, type 7 below. You're part of the small group that truly cares about protecting senior health. And if you're watching without subscribing, you're choosing silence over awareness. If that's your choice, write it in the comments. I want to hear your reasoning. Now let's talk about a medication that nearly everyone has heard of: statins for cholesterol. Number 8. Cholesterol medications, statins. Statins like atorvastatin Lipitor or simvastatin Zocor are among the most commonly prescribed medications in the world. They're excellent at lowering cholesterol and reducing heart disease risk, which is why millions of people take them. But some people report memory problems while taking statins. Picture this: a man starts taking cholesterol medication and begins forgetting where he parked his car, or he has trouble remembering names that used to come easily to him. The research on statins and memory is complex and sometimes contradictory. Some studies suggest that certain statins might reduce cholesterol in the brain, potentially affecting memory pathways. Other studies suggest that preventing strokes through cholesterol management might actually protect brain function. The important thing is not to assume that all memory problems are just normal aging. If you notice significant memory changes after starting a statin, it's worth discussing with your doctor. There may be different statins that work better for you, or the benefits of the medication might outweigh the risks in your particular situation. Finally, let's address one more important group: diabetes medications. Number 9. Diabetes medications. Older types. Managing diabetes is crucial for overall health, including brain health. High blood sugar over time can definitely damage the brain and increase dementia risk. But some older diabetes medications, particularly ones like glyburide, can cause blood sugar to swing dramatically between high and low. Here's what can happen. A senior takes medication for diabetes, but instead of steady blood sugar control, they experience frequent episodes of very low blood sugar. These episodes can cause confusion, disorientation, and symptoms that can look very much like dementia. The tragedy is that families might not realize these symptoms are related to blood sugar swings rather than permanent cognitive decline. They might assume their loved one's mind is failing when actually their blood sugar just needs better management. If you're managing diabetes and experiencing cognitive symptoms, work closely with your healthcare team to monitor your blood sugar patterns. Newer diabetes medications often provide more stable blood sugar control with fewer risks of dangerous lows. Now that we've uncovered these 9 medication categories, let's talk about what this really means for you and your family. I want to pause here and acknowledge something important. If you're watching this and recognizing medications that you or a loved one is taking, you might be feeling scared or overwhelmed right now. That's completely understandable, but I want to offer you a different perspective. This information isn't meant to frighten you, it's meant to empower you. Knowledge gives you the ability to ask better questions, advocate more effectively, and work as a true partner with your healthcare team. Watching someone you love experience cognitive decline is one of the most heartbreaking things any family can face. The feeling of helplessness, the grief for the person they used to be, the fear about what the future holds, these emotions are profound and valid. But here's what I want you to remember. You are not helpless. Your awareness, your advocacy, and your willingness to ask questions can make a real difference. Sometimes, what looks like irreversible cognitive decline might actually be a medication side effect that can be addressed. I've heard from families who discovered that adjusting medications led to remarkable improvements in their loved one's clarity and memory. I've also heard from people who caught potential problems early because they knew what warning signs to watch for. Your love and vigilance matter more than you know. Don't be afraid to ask questions like, could this medication be affecting memory, or are there alternatives we could try? Healthcare providers want to help, but they need your input to make the best decisions. If you recognize these patterns in your own life or in someone you care about, don't stay silent. Be their advocate. Be curious. Be persistent. The golden years should be a time of wisdom and connection, not confusion and loss. Let's take a moment to recap what we've covered today. We've explored 9 categories of medications that research has linked to increased dementia risk or cognitive problems in seniors. Sleep medications like benzodiazepines, which can slow brain signals when used long-term. Common antihistamines like Benadryl, which block brain chemicals crucial for memory. Certain older antidepressants that can interfere with cognitive function. Bladder control medications with strong anticholinergic effects. Opioid pain medications that can increase confusion and delirium risk. Acid reflux medications that can interfere with B12 absorption when used long-term. Antipsychotic medications that may accelerate cognitive decline. Cholesterol-lowering statins, which some people find affect their memory. And older diabetes medications that can cause blood sugar swings mimicking dementia symptoms. Now, I want to hear from you. Have you noticed memory changes in yourself or a loved one after starting a new medication? Have you had conversations with healthcare providers about these concerns? Share your experiences in the comments below. Your story might help another family navigate a similar situation. Remember, this channel exists to provide evidence-based health information that can help you make more informed decisions about your health and the health of people you care about. If you've found this information valuable, please consider subscribing. We share new content every week focused on senior health, wellness, and advocacy. And if you still won't subscribe, don't just disappear into the internet. Drop a comment and tell me why. What's holding you back from joining a community dedicated to senior health and awareness? I'll be here, waiting to understand your perspective. But most importantly, please remember that you have more power than you realize. You have the power to ask questions, to advocate for yourself and your loved ones, and to ensure that the medications meant to help are actually serving your best interests. The goal isn't to live in fear of all medications. Many of them provide tremendous benefits and are absolutely necessary. The goal is to be an informed, engaged partner in your healthcare decisions. Thank you for taking the time to learn about this important topic. Stay curious, stay informed, and remember, knowledge really is one of the best tools we have for protecting our health as we age. Until next time, take care of yourselves and each other.